Today we're going to talk about the ankle joint, primarily how to get the ankle to dorsiflex, which is when the foot comes closer to the shin bone. So in this video, you're going to learn why this motion is important, what are some of the reasons why you might lose this motion, and of course, how to restore ankle dorsiflexion. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel, we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to reach your highest maximum level. And all that being said, today you're going to learn everything and then some on the ankle joint. We're going to go over the anatomy of the joint because that's really important if you're someone who is trying to restore ankle dorsiflexion, why you might be limited and unable to do this, why it's important to have full range of motion into ankle dorsiflexion, and of course, ways to improve your ankle dorsiflexion if this is a motion that is limited on you. And we're going to end this video with a brief case study that will help you to understand why it's so important that you are going to the right healthcare providers that understand the anatomy of the body and how to take that anatomy and apply it to help you improve your range of motion. So first, as with a lot of my videos, we're just going to briefly go through the anatomy of the ankle joint because it's really, really important when you're starting to do your own range of motion exercises that you really understand the mechanics of the joints so that you will know how to properly stretch your ankle. So the joint in the ankle that we're going to focus on the most today is called the talocrural joint. And that joint is made up of the two bones, the leg bones that come down, the tibia and the fibula, and they attach to the talus. And the talus is really the main bone that I'm going to focus on helping you to understand kind of how this bone moves a little bit better, because this is the critical bone when it comes to restoring ankle dorsiflexion. So you have the two bones that come down and you have the talus that articulates to that bone. Now, the important thing to understand is how these two bones move on each other, how these three bones move on each other, and two motions are occurring. So the talus bone needs to slide backwards in order for the ankle to dorsiflex, and it also needs to roll forward in order for the ankle to dorsiflex. So what are some reasons why someone might lose ankle range of motion into dorsiflexion? One is if you have a contracture in the muscles that point the foot down. So that would include the gastrocnemius, the soleus, and the posterior tibialis. All of these muscles are on the back side of the ankle joint, and when they contract, they point the foot downwards. The other reason you might lose ankle dorsiflexion range of motion is if you have weakness in the muscles that lift the foot up, primarily the anterior tibialis. Another reason why you might lose ankle dorsiflexion range of motion is if you have spasticity in the muscles that point the foot down. So now what you're doing is you're getting an involuntary contraction of the ankle joint in the pointed position. Now, what's important to understand about this involuntary contraction in the pointed position is that talus bone. So when the foot points, that talus bone slides forward and rolls backwards. And a lot of you might already know this because you will see like a bump on the top of your ankle when your foot gets into that kind of pointed position. Some people call it like a macaroni noodle. It looks like a macaroni noodle when your foot just curves inward and really points down hard if you have a lot of spasticity. Well, that is basically the talus bone. So it is slid forward. So now that we understand a little bit of the anatomy, what do you do to restore ankle dorsiflexion? Well, first, you need to make sure you slide that talus backwards and allow it to roll forward. So we're going to go into how to do that, but that motion is really important. And so I'm going to tell you kind of the right way and the wrong way to stretch the ankle joint. And then also the other thing that is extremely important is to make sure that you have full range of motion or lengthening of the gastrocnemius, the soleus, and the posterior tibialis. If they are shortened, it is going to make it harder to dorsiflex that ankle. So one way that we ensure that we have a little bit of slack in those three muscles is we bend the knee. So that's really important when we get to the range of motion exercises, is remember, if those muscles are pulling that foot into a pointed position, it is going to make it a lot harder to stretch it into dorsiflexion. So one way that it makes those muscles more taut is if the knee is straight. So the gastrocnemius is actually a muscle that also crosses the knee joint. So if the knee is straight, it actually puts more tension on that calf muscle or that gastroc muscle. So when you bend the knee, what you're doing is you're giving a little bit more slack to that gastrocnemius muscle, and you're going to get less resistance when you go to attempt to dorsiflex the ankle or stretch that ankle into dorsiflexion. So the way you want to be positioned is in sitting or laying down with your knees bent. Sitting is the preferred method because you can kind of use the ground a little bit more to get that ankle into a more dorsiflex position. It's a little bit harder to do this laying down, and I'll show you that a little bit further on in this video. But definitely, if you have lost ankle dorsiflexion range of motion and people are trying to force your foot into dorsiflexion, or you're trying to get your AFO on and you can't get your heel all the way back, you definitely want to be sitting or somehow have that knee bent. Now, when it comes to stretching, remember that talus bone. The key, most important force that you apply to that ankle to get dorsiflexion is not what most people think. So most people think you just got to push up on the foot. The most important thing you have to do to achieve that motion is to glide that talus bone backwards. Remember, if you've had plantar flexion for a long time, or that foot's been pointed down for a long time, or you have spasticity in the muscles that point the foot down, that talus bone is going to be sitting really far forward. And if you just go and try and thrust that foot up and that talus bone is sitting really far forward, you're not going to go anywhere. You're going to be hitting a wall. So it's really important that the force is the web space of your hand pushing that talus backwards. And then, of course, in addition to that, you want to lift up on the foot. The way I like to do that is to use the ground and then to use my body weight to kind of leverage that. So sitting, having the knee a little bit above the hip joint is the ideal position, and then you can really leverage your body weight to push that talus backwards as the ground helps you to push the foot upward. So the moral of the story, or the key to this video, is that very important peak component of pushing that talus backwards or sliding that talus bone backwards when you're dorsiflexing the ankle. And here is what that would look like. If you bend the knee, what that does, it just gives a little more slack in those muscles, so if they are a little bit shortened, you'll still be able to get good ankle dorsiflexion without necessarily having to have that full range of motion back there. Now, keep in mind that 10 degrees that I told you is necessary for walking, that is necessary with the knee straight. So you eventually are going to have to be able to get that 10 degrees of ankle dorsiflexion with the knee straight. But in the early stages, and most people don't have full ankle range of motion towards dorsiflexion because those structures are tight in the back, especially after a stroke or a brain injury, always best to start with the knee bent. Best case scenario is sitting, because you can actually use your body weight to help stretch that ankle. So I always recommend a step with the knee above the hip joint, and then bringing that foot back as far as you can. So you're kind of setting yourself up for success. And if I just leaned on the ankle in this position, you can see I could get a pretty good stretch. So if my only goal was to kind of start stretching out the structures on the back, and I was extremely tight, meaning the foot was extremely pointed, this is where you would want to start. Now, I mentioned that talus bone. An even better stretch is to make sure that that talus bone is sliding backwards when you get in this position. So one way you can do that if you don't have help is to have some kind of a resistance band. You want a pretty strong resistance band right in the bend in that ankle, kind of pushing that talus bone backwards. And then all you're going to do is kind of scoot forward, lean forward, and press down on that leg, kind of using your body weight to help get a little bit of a deeper stretch. Now, a little bit of a side note here. A lot of people have trouble getting their heel all the way back in your AFO. This is a good position also to get your foot in your AFO, starting with that knee bent, getting that heel all the way back, getting that ankle strap on really, really tight first, and then straightening your knee out is always going to get your foot seated in that AFO in the best position. But again, what you're trying to do is use this band here to help push that ankle bone backwards, that talus bone backwards. Now, if you have someone that can help you, what they would want to do is stand in front of you and face you and put their hand right over the top of your foot and push back. So if you have a caregiver or you are a caregiver and you want to help someone, you would stand in front of the person and push backwards on that bone, and you can even take your other hand and bring their knee forward. For those of you that have had a stroke, it's actually preferred that you do this with a second person. I just find that this strap, getting into this position, isn't always easy if you have hemiplegia. So definitely, if you have help, tell the person that's helping you to take the web space of their hand, put it right in the bend in your foot, and push that foot backwards. Now, if you're someone where your foot really supinates or rolls to the outside, now we're going to kind of want to address the foot bones that attach to the talus bone. So the foot bones on the other side of the talus bone, you would want to move your hand down a little bit, and you would want to make that force, instead of that force going straight back, you want that force to go more inward towards the arch of the foot. That is how you mobilize the ankle to work back towards getting full ankle dorsiflexion. And then of course from here you could go to a variety of ankle dorsiflexion stretches in the ankle stretching category, where you will learn how to stretch the ankle with the knee straight. Remember what I said, to get proper walking mechanics or to get a proper gait cycle, you really do need that 10 degrees of ankle dorsiflexion with the knee straight. Now, the other thing I want to mention is a question that came up, whether or not there was risk of tearing the Achilles tendon, which is the muscles on the tendon that attaches the muscles on the back of the ankle to the foot bones, and I think it's very hard to tear the Achilles tendon. So if someone has normal sensation and they can feel pain, I would say that that's a good sign, because usually pain will stop someone from allowing someone else to apply that much force. But also usually an Achilles tendon tears under an eccentric load. So when the Achilles tendon is being lengthened while it is also contracting at the same time, that is when you'll usually tear it. So that's why you see basketball players usually tear it when they land, because that is an eccentric load on that Achilles tendon. Stepping down off a curb, things like that are usually when you would be more susceptible to tearing the Achilles tendon. I think it would be rare for a human to be able to apply enough force to tear the Achilles tendon. So definitely listen to your body, but I don't think that that's a high concern as far as stretching the ankle. I hope you guys found this video helpful. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button, turn on that notification bell so that you'll get notified every time I upload new videos. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.